Good afternoon. My name is Linda Cafe, and I'm an MSW student at Widener University, and I have been given the assignment of psychosocial development, Erickson's theory of psychosocial development, stage 2, which is entitled Autonomy versus Shame and Doubt. According to Erickson, this is the stage that children range in ages between 18 months and 3 years. It is in this stage that children learn to do things such as eat, dress, independently. To accomplishing various tasks, children gain a sense of self-confidence. If children's independence is not encouraged, or if they are punished for acting on things independently, they can develop a sense of self-doubt. The purpose of this presentation is to discuss children in this developmental stage and the risk which may be associated with a dysfunctional household, low economic status, single-parent dynamic, health and or medical issues, nutrition, poor parenting skills, lack of awareness, and assessing resources within interactional environment. This oral presentation discusses the risk associated with children at risk because of the single-parent dynamic, the parent's lack of education and or employment experience, poor parenting skills, drug and alcohol dependency, and sexual promiscuity. Some of the risks that may be associated with the stage of early development are poor nutrition, related health issues and concerns, homelessness, inability to attach or become attuned with the biological parent or caregiver. Homelessness is often associated with substance abuse, but whether substance use precedes or follows homelessness is unclear. The relationship between homelessness and substance use is used by data from the unique Australian panel dataset Journeys Home, collected in 4 surveys. And according to these surveys, homeless individuals are more likely to be substance users, and substance users are more likely to be homeless. Alcohol can be the reason for an individual to become homeless as well. Some of the causes for these at-risk behaviors are high school dropout, drug and alcohol usage, and or sexual promiscuity. High school dropouts, and most recent studies reported by the United States Department of Education revealed nearly 12 million students between the ages of 15 and 24 dropped out of high school in 1 year alone. These statistical findings suggest that 1 in every 5 students will drop out of high school between the 10th and 12th grade for one reason or another. Reasons why teens drop out of high school is lack of education and support, outside influences such as peer pressure, special needs such as being ADHD or dyslexic, financial problems, a lack of student interest, drug and or alcohol abuse, depression or physical illness, physical abuse, or teen pregnancies. In regards to drug and alcohol abuse, marijuana is an illegal drug that teens use for numerous reasons, including its availability. It is a plant that is dried, and to use the drug, its leaves, buds, and stems are smoked. Some of the more common street names are pot, grass, weed, Mary Jane, and reefer. There is a strong relationship between alcohol use among youth and many emotional and behavioral problems, including fighting, stealing, driving under the influence of alcohol and or drugs, skipping school, feeling depressed, and deliberately trying to hurt or kill themselves. In regards to sexual promiscuity, teenagers often partake in risk-taking behaviors. This seems to be a common theme among adolescents, but it can become a serious issue in troubled adolescents. Sex may become an outlet for a struggling teen's frustrations, much in the same way drugs and alcohol serves as an outlet. In this way, sex becomes a drug, a way to escape feelings and emotional confusion. However, as with any drug, there is a backlash. Any teenager who is acting out sexually will begin to feel a diminished sense of value and self-esteem. They are simply trying to find someone to love them. Unfortunately, they are looking for love in all the wrong places and by using inappropriate behaviors. Social worker involvement with these adolescents, teens, or early childhood development stages are inclusive to counseling, mentor programs, and social work interventions. Next, you will be privileged, as I was privileged, to listen to an interview that I was blessed to have with one of my neighbors. She's a young woman whom I have known for the past few years, and it is my experience that this young woman has experienced all of the prior things I just mentioned, from the homelessness to the drug and alcohol usage to the sexual promiscuity, even having early childhood pregnancy, which placed not only herself but a young child at risk. I hope you enjoyed this video. Charlene was born in Chambersburg, Pennsylvania. She's the second oldest out of 4 children. She herself was born to a mother who was drug and alcohol addicted. So it is in my opinion that Charlene is a victim of intergenerational drug and alcohol abuse. She was placed in foster care at the age of 11 years, and at the age of 14 she was abused while still in the system, which also, in my opinion, fostered some of her negative behaviors. She then used this issue as an excuse to run away, as she was abused in the system. She also started to abuse drugs, marijuana, and alcohol at a very young age. I think by the time she was 9 years of age, she was already smoking marijuana and drinking. She also became involved in prostitution as a means to support herself. And, as I said earlier, she became a mother at the early age of only 17 years. Please sit back and enjoy the video.